can start with the slides. So this is specifically around, so this slideshow does a little bit of the doula benefit overview that Sam Sarah gave earlier. So we can walk through that like a little bit more quickly. Gives an overview of the Alliance. We included some information about our birthing members from last year. So you can kind of see some of that demographic information of our members. We talk a little bit about the doula program, so that is how we are like implementing the doula benefit at the Alliance. And then we talk a little bit about like the contracting and credentialing process. So the brief overview, Alameda Alliance for Health is like a small local nonprofit managed care plan. It was created by the residents of Alameda County for Alameda County residents. And it's just really committed to, you know, ensuring the residents of Alameda County have access to really high quality care. And it was established in 1996, so it's almost 30 years old. And we really pride ourselves in having a staff and having providers and offering services that are reflective of our community. So being like culturally and linguistically concordant with our community. Our mission and vision, improving health and well-being for our members by collaborating with our providers and community partners to deliver that high quality care and accessible services. And our vision is that all residents of Alameda County will achieve their optimum health and well-being at every stage of life. We have these things called our track values, and they're basically like our organization-wide values, and they make the acronym TRACK. So we focus on teamwork, respect, accountability, commitment and compassion, and knowledge and innovation. So we work together as a team, we support each other across different departments, we support our providers, we support our members, we respect everyone, we treat others as we would like to be treated. We hold each other accountable, recognizing that there are barriers that exist in the system, and how can we, as a healthcare plan, try to minimize those barriers and increase access to care for our members. We're committed and compassionate, which hopefully everyone in the healthcare system is, but I know that's not always the case, but we like to think we are committed and we are compassionate. And then knowledge and innovation, so really trying to find better ways and creative ways to increase care and access to care for our members, and make sure that that care is of the highest quality. So on the next slide, we give a little bit of an overview of our pregnant members. So last year, for 2023, we had almost 5,000 pregnant members with the Alliance. You can see 100% identified as female. The age band for most of our birthing members last year was between the ages of 21 to 49. That's accounts for, I think, like 80% of our members. You will see we have about 8% of members who are 12 to 20 years of age. And then we did have a small portion of members that were 50 to 64.
This would be identified anytime, so this does not mean that they made it to term. They could have termed the baby, but there was some indication of pregnancy at some time. Yeah, just to put that into a little bit of context.
We break Alameda County down by region because it's huge. It's huge, yeah. And so a majority of our members live in North County, and North County consists of like Albany, Berkeley, Emeryville, Oakland, Alameda. Our central areas are like San Lorenzo, San Leandro, Castro Valley, Hayward. You can tell who's...
I made these up. I was frustrated. I was like, how do you say quickly like where members live? And so one of my staff always laughs at me because she's like, you know you made these up, Linda. I said, I know I made them up, but it helps me.
It does help. It certainly helps. So a majority of our members are living in the North region. The second largest group live in the Central region. The South regions are like Hayward and Fremont.
It's actually not, that's actually just Fremont, Tri-Cities, so Fremont, Newark, and
Oh,
Union
okay.
City.
South. And then east is
Very
Dublin.
Pleasanton, Dublin,
Okay.
Milan.
Nice. Yeah, so it is huge.
I would say Alameda is big.
It's big,
Mhm.
yeah.
I didn't realize.
Alameda
I'm
County's
thinking
massive.
of literally Alameda, the little Alameda.
Oh.
Yeah,
Really,
right?
the whole county.
Yeah, the county itself is huge. This slide also goes over like the primary race and ethnicity that our members identify with. So you can see that actually the highest number is other. And Linda brought up a really great point of this yesterday, but right now the way that we designate race and ethnicity, we don't have like a mixed race or ethnicity or like more than one option. So we do have,
Basically the medical application.
yeah,
Mhm.
yeah.
Is right
So we speculate that a lot of our members do not identify with just one race or ethnicity, and so they end up choosing other, and that's why.
now. Or choose not to designate.
Or choose
you know,
not to
just
designate,
there.
because we do have the unknown too, yeah. But then after that, a large group of our members identify as Hispanic, Black, White, Chinese, other Asian, Vietnamese, Pacific Islander, and then, yeah, like after our white members that identify as white and going downward, there are smaller percentages. So the largest group of our members make up that other category or identify as Hispanic or Black. And then as far as language goes, a majority of our members do say that English is their first language and Spanish is their is the second largest group. And then we also have members that speak or say that their primary language is Chinese, Arabic, Vietnamese, other non-English, unknown, or Tagalog. Tagalog, sorry. I
That's
always
Tagalog.
do that the first time. And then I hear Tagalog and yeah.
What is sign language following? Is that not non-English?
think
It would be the in other non-English, because it's smaller, it is quite a
It
bit
is
smaller,
small?
but we do
Oh,
track
okay.
it, we do know our
Mhm.
members who speak sign language, and the Chinese is mostly Cantonese in case someone cares to know. Which is just because of the demographics of this area and other counties. But also a significant number of Mandarin speakers, more so than Arabic or Vietnamese speakers.
Yeah. And we do have what do we call our what are like the languages, the group of languages that we make sure that we have they're like our
Threshold languages.
threshold
yeah.
languages. So we do have a group of threshold languages that like all of our materials are offered in those threshold languages, but we do also have an amazing cultural and linguistic services department that can interpret, for other languages, because even within a single language there are so many different dialects and there can be variations even within
Last
that
year,
language. So
57,000 services we offered to our medical members of interpreter services in 122 languages.
Wow.
Yes.
So, through 3 different languages. I'm also responsible for that, that's why I know the numbers.
yeah, so we very much try to communicate with our members in their preferred language and their primary language.
And that service is available to our doulas as well.
And then thankfully a majority of our pregnant members were housed last year, but we do have about 9% of the population that was not housed last year during their perinatal.
And again, not the easiest thing to track, so you take the numbers for what they are. I'm sure there's folks who weren't identified that should have been identified as unhoused, and other folks who may be wrongfully identified. They might be using social services address as their address, and we might look at that as unstable housing if they're not using a street address. But
So doulas at the Alliance, I'm sitting in front of a group of doulas, so I don't have to tell you all what doulas do, but you're all birth workers who do amazing things for clients. Provide health education, advocacy, physical, emotional, non-medical support for pregnant and postpartum persons before, during, and after childbirth, miscarriage, stillbirth, or abortion. And so as Samsara reviewed before, the doula benefit was actually passed in January of 2023, so about 19 months ago. And MediCal will now reimburse for these set of doula services, which is part of the now standing recommendation. So every member that is a MediCal member is eligible to receive these services. You don't need a recommendation or prior authorization to give these services.
You have to be pregnant and have a postpartum.
Yes.
True. True. It does have to be to a perinatal member. Yes.
Just a slight little. Might be some guys who are jealous and they want that.
I know, who wouldn't want this? Who
That
wouldn't
would be
want
fun.
all of this
I
support?
just want to doula.
Yeah.
Doulas are so freaking helpful.
I said this to Samsara. I like walked in here. I was like, the energy in this room is so wonderful. I feel like I'm getting a little bit of like doula services just
Yes,
being here right
you
now.
are.
Doula support just being here.
I agree.
So that includes the one initial visit, up to 8 additional visits that can be in any combination of prenatal, postpartum, support during actual labor and delivery, regardless of the result of that labor and delivery, and then those 2 extended 3-hour postpartum visits. So that is for all MediCal eligible members. We also, at the Alliance, I maybe should have mentioned this before, in the Alliance we have what we call 2 lines of business. One line of business is our MediCal members, and then the other line of business are our in-home support services. It's a much smaller group it's a much smaller group of members, but we made the decision that since the state feels as though members who are enrolled in MediCal deserve and should have the access to doulas, we also want to provide that access to our in-home support services members. So
It's actually workers, so not folks that have it, but the folks who, provide services that
for in-home support, so like caregivers essentially, so if those caregivers are pregnant, they can also have access to doula services through the Alliance.
That's really cool.
And all of those services on that doula benefit slide are under the standing recommendation. So you can provide those services without any need for recommendation from a licensed clinical provider.
I do wonder how that works, so without a standing recommendation. So a pregnant person, pregnant woman, goes into a doctor's appointment, right? They're pregnant, and then the pregnant person approaches us, or the doctor says, "Hey, can you use a doula?" And then a doctor calls us. I mean, I'm just wondering how
So basically, the doctor doesn't have to be involved.
at all.
So in this way, the member themselves can call member services and say, I'm looking for a doula. They can share with them names from our provider directory, and the member can go directly. You all as doulas will know there's a standing recommendation. If an actual recommendation is needed for those extra services, then you would have to go back to some medical professional to get a recommendation and kind of slip that in their file, like have that on record.
So members could reach out directly to you. Providers may also reach out to you if they're just like helping their member get in contact. But we have on the Alameda Alliance website, we have something called the Provider Network Directory. So if you're contracted with us, you can put as much information there as you'd like, but we ask like at least your name and phone number so members could reach out to you.
Well, it's pretty organized. Like
it is.
You can't put everything. He was like, I'm an exceptional doula. It's name.
As far as contact information goes, I guess.
Contact information. I'm sorry. I
Yeah.
don't want to be misleading.
So that for those initial services, you don't even need to, involve a medical professional if you don't want to.
So it doesn't need a referral, none of that?
Nothing.
Correct.
Yeah,
That's what that
standing recommendation.
is.
Yeah.
There's no prior auth, so nothing
Right.
has to go through to get kind of approved at the Alliance in order to start those services.
Right, but we want to partner with the doctors. We want
Absolutely.
them to be recommending people who might really need an extra support person.
Yeah.
Yeah.
And that is, I feel like that's a whole that's a whole conversation, but we are, you know,
Part of
we
our strategy.
it is part of our strategy, which we'll get to in a little bit, but
Thank
yeah, trying to not work in silos and trying to like involve everyone that should be involved. Cause yeah, it's all about providing that safe perinatal period for our members, so.
Thank you, didn't
Yeah.
Appreciate that input though,
Yeah.
the importance, not that we're trying to avoid it, but it's trying to eliminate barriers.
Yeah.
So,
For sure. So doula services can be offered in person or virtually. And the locations can be in any settings, including but not limited to homes, offices, hospitals, or alternative birth centers. So if you and your client want to have a home birth and you are a MediCal provider, you can bill for that birth, even if it's in the client's home or your home or your office, what have you. It does not have to be in a hospital, it does not have to be in a
paying
birth
for the
center.
birth, but that might be complicated around who pays for the actual birth, but the doula service.
The doula services, right, sorry.
I will say, the Alameda Alliance, our birthing center here in the East Bay is Pacifica Family
Mhm.
Maternity Center,
Mhm.
and
They are
the
on.
Alliance will
Mhm.
pay for the births
Yep.
there for birth with the midwives.
Mhm.
And if they have a doula, then they put them in the doula.
Oh, is that the one up the Ohio?
Telegraph Avenue.
Oh, Telegraph, okay.
Oh, is that
Right around the corner from Outer Banks.
right?
You can run.
And then like we mentioned before, so if you feel like your client does require additional postpartum services, they can get up to 9 postpartum services, or additional services, but that does require a recommendation from, a licensed, clinical provider. I do know that there is work in a lot of the calls that Samsara goes to, we also try to be present on. There has been a lot of talk about removing the need for that recommendation for those additional services. So we'll see if, that's something that happens in the future. But for right now, if your client does require those additional 9 services, you do need a recommendation. And I did list out some of the people who could recommend. So physician, nurse practitioner, physician assistant, registered nurse, a pharmacist, licensed clinical psychologist. You've got a whole list here for other licensed eligible practitioner working under the supervision of a licensed clinician.
That would be an MFT, right? So if they're therapists, could recommend them.
Oh, yeah.
Family therapist, yeah.
On the next slide, when it talks about doula services of covered and non-covered services, so the covered services are what MediCal will reimburse you for. You can offer all of these services to your clients. It's just the services listed under non-covered services, you can't be reimbursed right now through MediCal for those. You can obviously still offer them, but you can't, submit a claim and ask to be reimbursed for them. And so how members get in touch with doulas at the Alliance, number of different ways. Members can go directly onto our website and look up review the provider directory, and directly connect with a doula. They could they could be speaking with a healthcare provider and they recommend a doula, and then they could get you set up that way. There are lots of different ways. They could call into member services and say, I'm looking for some additional support during my perinatal period. What do you have to offer me? And get referred that way. So there are a number of different avenues that members could get in contact with you.
Any questions? You guys aren't shy, so we're good.
So the Alliance Doula Program is how we are enacting this benefit through Alameda Alliance. We just want to make sure our perinatal members have access to the services that they need. And like Sarah alluded to before, there's so much research about the benefits of having a support person during the perinatal period and the impact that that can have on both maternal and child health outcomes. And it's great that it's something that the state is now recognizing and going to be reimbursed for. And so we are trying to make that as seamless as possible, recognizing that there are still a lot of barriers and, hoops to work through. Lots of opportunities for improvement. But we do, our aim is to make sure that our perinatal members have access to these services.
If I could add to that, it truly is woven into kind of a birth equity perspective, and we're promoting this at the organization with our peers and in the community as one of the ways that we're really trying to right some wrongs, right? That this is a critical piece of that work and how we're looking at the importance of it. So just wanted to recognize that.
Definitely, like addressing the health disparities that exist nationwide and also very much exist in Alameda County. I mean, Alameda County's rates for maternal morbidity and mortality are awful. And this is, yes, one of the ways that we're trying to address that and trying to close that gap and close that disparity.
Is there a reason for that? Or why is that?
Oh, I don't
Why
know if
is
we
it
have
that
enough
way
time
the
for
whole
that.
If folks are interested, I mean, I'm sure some resources and there's some really exceptional research that's been done and looking at, but definitely looking at, you have to go pretty far back, like you have to take historical factors into consideration.
Yeah, you go back to enslaved black people.
Exactly.
Yeah.
Go back to the birth of gynecology.
Started
Yeah.
reading that book that, what was it called? The birth bondage or something.
Hulu just put out, I don't know if anyone's seen the 1619 Project.
Yeah.
Which one?
Hulu just put out a series of 1619 Project, and her name, Nicole, something's like, I forget her name. But they touch a bit on, they provide, some of that historical context, and it's.
I'm forgetting his name right now. Who's the fake father of gynecology?
Oh,
Oh gosh, it was in the book.
Come on.
She talks about it, I forget his name.
What's his name?
Jameson.
We should all spit as soon as somebody remembers. We should all spit. Yeah. Anyway, he was what, 17 something, 18 something, 19 something. Anyway.
So 1619 Project?
Mhm.
So that was when enslaved people.
We need to address that in one of our meetings. We'll talk about the history. I've got actually a really great presentation on it. I can show you. Okay. We should all know why it's crazy in this country. Crazier than any other industrialized country. We lose the most mamas and babies here than any other industrialized country.
And so I'm sorry, can somebody, they said the name of the person.
J. Marion Sims.
Marion Sims. I finally took his stinky statue out of my beloved Central Park. I'm a New Yorker. And I cheered in my home in Oakland when they tore down his statue finally in the past, 2-3 years. Very recently they took his statue down. Evil man.
Very much so.
Oh goodness, if we could talk about birth without talking about evil men, it would be really nice.
I know. That should be the doula programming.
Yeah.
That should be our aim.
Yes.
And so how are we going to go about achieving this aim for our members? Support a robust, knowledgeable, and a high quality doula provider network that is integrated across our continuum, which means not working in silos, but addressing the need for doulas and the right for doulas to provide this care to our members across, all areas that we work. I say expand the diversity of our doula network. I actually think you know, our doula network right now is really reflective of our community, and I think that's wonderful. We actually have doubled the number of contracted doulas that we have at the
Nice.
Alliance. We now have 12, which is great. Yes, that's great. And 10 of them identify as people of color, which is great, because as you could see, our membership, we have members from lots of different races and ethnicities. They speak many languages, and so, you know, our providers need to be reflective of that to be able to provide the care that our members deserve. So there's always room for improvement, so we can always continue to expand, but it is
It
something
goes
I'm
more, I actually the one who edited this on you, but we want to expand the network, but
Expand the
and do
network,
that in
yeah.
a way that continues to reflect the diversity.
yes,
There you go.
yes, and
My
and
bad.
and provide that culturally and linguistically concordant care for our members. Educate our providers and members about doulas and the benefits of doulas and doula services. Identify and provide some more targeted support to members that are experiencing inequities, and what we can do to help overcome some of those inequities, and then positively impact the maternal and infant health outcome disparities that exist in Alameda County. So, contracting with us.
Sorry.
No.
It's actually-
It's yeah, I think, you know, something that I like to something that I like to remind myself is that this is the first time Alameda Alliance is contracting with a non-clinical provider, and so, like licensed clinical provider. So it's a learning opportunity for us as well, and I think we've done a lot so far, and I know we still have a lot to do. So right now, to contract with the Alliance, you do have to be PAVE enrolled. So PAVE stands for Provider Application Validation Enrollment, I think.
Sounds right.
I don't
Yeah.
know that.
And Sam Sarah went over those kind of eligibility criteria before, but you have to be at least 18 years of age. You have to have your CPR license. You have to have like documented HIPAA training, and you have to have an MPI or National Provider Identifier, and then meet qualifications either through the training pathway or the eligibility pathway. To address something that Sam Sarah brought up before, the Alliance recognizes PAVE eligibility through both the training and eligibility
Round
and
of
experience
applause on
pathway.
that one. Round of applause on that one. Because
We
you're not
we
yes.
recognize both the training and experience pathway. Yeah.
Totally.
Either or will suffice for us.
It's kind of wild that some healthcare plans are not, but we are recognizing both of those pathways.
We love you.
We love you too. So contracting with us, you can reach out to the provider services email. I actually do have some other email addresses I'm going to share with you before the end of the day here, but you can reach out to our provider services department, and just, you know, when you call, you say, I'm a PAVE enrolled doula looking to contract with the Alliance, and they send you the contract and some like onboarding paperwork. One thing that they do request that you have, like, when you want to contract with us, is your W-9 form, which is basically just like your tax identifier number. And I think that depends on whether you're contracting as a solo individual practitioner or if you're going like through a business, but it's the tax identifier for either yourself or your business.
So is that the EIN number?
EIN number.
Yeah.
I
Yeah,
think
so
so.
that's-
Yes.
It could be your
Yeah.
social security
Or it's just
number.
You could just use your social
Okay.
security.
If you're a
Sorry.
solo
Okay.
practitioner, sole
Yeah.
So
proprietor, thank
Yeah.
you.
Okay.
And that W-9 form is gonna say the same form you filled out for any other job you've had, like any
Okay.
employer in California, you know, has to fill that out.
Okay.
It basically
Okay.
says, you know, this is how I'm gonna be paying my taxes.
Yeah.
Right.
And then they'll send you the contract, which you can review, and then you complete that. and the credentialing application, and you can either drop that off to us, you can mail it, you can fax it, or you can email it to that DISC group credentialing email address at the bottom of that slide there. So a couple things about the contract. It's very long, and again, this is the first time that the Alliance is contracting with licensed clinical providers. So they have used this contract for all other medical professionals that have contracted with us, and there's a lot of information in there that are not applicable to doulas. And so we have a very long contract right now, but our contracting department is working on creating a pared down contract for doulas that's gonna get rid of all that extraneous information that is not applicable to you and the services that you will be provided. I will also say, because we are a MediCal plan, any materials or documents that we create that are like member facing or provider facing need to be approved by the state. So once we create this contract, it goes to the state for approval. When we get that, then we can start using that contract with our doulas. So it is a bit of a slower process, but it is something that we're working on right now, because we have been in a lot of meetings that, it's been brought up with our community that the contract, there's just like a lot of information in there that's not necessary, and people feel uncomfortable signing it, and I don't blame you. So we're trying to get rid of that
Quick
extra
question.
information.
So I hear folks are working on a more streamlined contract, thank you. So folks who sign now, what happens? Do they get the new contract? Does the first one get negated? I actually want it to be,
Oh,
because
that's really interesting.
because people are signing on to things on that they're not really.
Thank you.
Do you know what I'm saying?
Yep.
But so when it's an actual doula contract,
Yep.
can that be negated and the new contract be what doula?
Thank you.
You know, you get a new contract, you signed a new contract for a doula.
Yes. Yes. That's great feedback. Thank you.
Yeah, we'll have to take it back, not as, that's super.
It's a
interesting. We can
pipeline.
definitely take that
Go-
back.
Yeah,
Just in
but
terms
that
of
would be
our working
really
with the
good.
state, they usually will provide a new contract with any new language. I mean, they just,
I do not trust them.
Yeah. You like
And then,
those,
and then when the
like
doula gets into trouble, and then lawyers get involved, and you
You
signed
signed,
something.
yeah.
Right.
Yeah,
Yeah.
that's true.
And that's
So we just
one.
wanna, I trust my kids, that's about it.
Right, yeah.
And Jesus, I'm down with
Yeah.
him.
And at the time you signed the contract, are you guys asking for insurance? From the doulas at that
You
time?
Yes.
Yes.
At that time, yeah.
Yeah, yep,
So
yep.
for us, it's kind of like there's two pieces, and it's two different departments, so just to, because it could be confusing if working with different folks, so there's the contracting department, and then there's the credentialing department, and within the credentialing is where they ask for the insurance and some of the other documentation.
Yeah.
Because they hold that and then make sure, oh, it expired, or did you need to renew it, or like those are the folks that kind of are tracking over time. Oh, did they complete the training that they had to every 3 years? They're the ones tracking those pieces, the training and other things.
Yep.
Contracting just gets you started.
Mhm.
Yeah. So there is an alternative to a contract right now for doulas that you don't have to be PAVE enrolled. You can be in the process of PAVE enrolling. It's something called a letter of agreement. So the letter of agreement is for doulas who are not yet PAVE enrolled, who want to provide doula services to MediCal members. They may still be reimbursed for those doula services through a letter of agreement with the Alliance. Typically, letters of agreement, like their duration is only like 3 to 6 months, so it's not for a very long period of time, but it's a way to say you are seeing a client right now and they're close to giving birth and you want to be reimbursed through MediCal for that birth. You could sign a letter of agreement with the Alliance as you're working through the PAVE process and get that reimbursement. And I did bring a sample letter of agreement for y'all to look at. It's
much shorter.
much shorter, yes. It's much shorter. It still, again, has some language in there that is not applicable to doulas, like needing to get a prior authorization for services. You don't need that. But it's an alternative for a contract. Of course, we will encourage you to contract with the Alliance because there are a lot of benefits to contracting that we could talk about, but I think one of the most important things is when you're a contracted provider with the Alliance, you have access to a provider portal, and you can actually submit all your claims through the provider portal. You can track your claims, and they tend to get paid a little bit more quickly through the portal as well, just because it's all electronic. When you have a letter of agreement, you actually have to physically fill out a claim and mail or fax it in to our claims department. It adds a little bit of like time and getting reimbursed for services.
Provider portal will also give you access to be able to confirm someone's eligibility, so whether a member is actually a member, right? Because unfortunately, some of our members, they're like, they know they've got MediCal, but they're kind of like, is that Alliance, or who is the Alliance? So it's helpful in terms of confirming that you are working with a member, because if you do submit a claim for someone who's not a member, that we can't reimburse for, right? We can't.
But if you sign a letter of agreement and you do want to provide services to that member and you want to verify their eligibility, you can call that provider services number and we can confirm members' eligibility for you that way. But yes, having access to the provider portal, probably quicker, and you could just look the member up online. Any questions about those two things? Okay. And then credentialing, you can see, is quite a checklist. So to be credentialed is completing and signing and dating the application. I also have a copy of that with us. A language assessment. So if you are bilingual or speak multiple languages and you want to provide services in multiple languages, we ask that you share that information for us because it also helps us better match members with providers. And the language assessment, do you want to speak to what the language assessment is? Do you know what the language assessment is?
I don't know why they call it assessment.
It's like an attestation. Yeah,
you're saying I speak this language.
Yeah.
This is a language at my, and then that language information, that is one of the things that's added to the provider directory, so that any member or provider who's trying to connect a member with doula services knows what that's available.
Yep. A complete signed and dated attestation page. So this is going to be the same attestation that you sign for PAVE when you say that you are eligible either through the training or experience pathway. At this time, the Alliance also requests a copy of that attestation, even though you're sending it to the state. Again, another opportunity for improvement. If the state would share some of this information with managed care plans, we wouldn't have to ask for it multiple times. Any documentation that you need to support that attestation, so for the experience pathway, like your letters of recommendation, we'll ask for a copy of that too. A copy of your CPR, the W-9, which again is like your tax identification, federal employer identification number. So I think those are one and the same. Yeah, the W-9
is a form that
is the form, and then
that says
you put the number on the W-9.
On the W-9, yeah. Copy of your ID, your business license or tax certificate, and then this is where you'll need the insurance. So we do ask for a professional, liability insurance of 1 million per occurrence or 3 million aggregate, which is probably
what they have.
What Samsara has. And then we also ask for a resume for like your doula related experience. And then when you enroll in the PAVE system, you get like you get a confirmation number or form from DHCS. We ask for a copy of that, which is either the 6207 if you're contracting as a group, or the 6208, which is for all like individual practitioners. So I think depending on how you're enrolling in PAVE is the type of form that you'll get back is like the confirmation.
And the resume, I know it seems a little extra, but it is, again, you know, as any plan, we have our whole credentialing process, the policies and procedures, everyone's asked for a resume, and so this is included in what we ask, not just of doulas, but for all of our providers at this time.
What if you were just starting out as a doula? Just put your other.
Then your resume would reflect that, your training.
Anything.
Okay.
Yeah.
Yeah.
But I think you can put on your resume, I mean, this is a resume, this is your employment experience. So I think it's, you know, if you've been doing other things as well.
Yeah.
Okay, or if there was a break in employment, it says here, then, you know, give an explanation. Say, hey, I went back to school, I had a kid, I, you know, whatever happened in that time. Pandemic.
I know. So those are the slides. Any other questions? Yeah?
How far back in your employment history you have to go back?
It's just
5.
Yeah, just 5 years. And then it says if there was a gap of 6 months or more, then go ahead and give an explanation of what might have been going on during that time.
So then, these other flyers in here are just some of the other services that we offer members. So, I think just nice for y'all to know as potential providers, like what other things, your clients would have access to. So we have support for members specifically like, in the prenatal period and then postpartum. We have a lot of, we offer our members a lot of classes, so like childbirth parenting classes. They get breastfeeding support, they have health handouts. We have a lot of our members access some of the support groups that are offered through Alameda County. So they have like a fatherhood initiative, and they also have like a dad's cafe fatherhood initiative. They have, yeah,
We pay for prenatal classes at any of the hospitals in Alameda County.
Yeah.
So we'll cover the cost of, luckily, a lot of our folks are also getting prenatal classes at their clinics. If they're with some of the federally qualified health centers like La Clinica or, you know, West Oakland Health Center. Actually, I think they just changed their name. Anyway, Lifelong, other clinics like that, Alameda Health Systems clinics, they also may have prenatal classes. But some of the moms aren't there, and so they want access or they want more information. They
Yeah.
want to take both.
yeah. And then we also have our Birthwise Wellbeing program, which specifically focuses on mental health for birthing persons, since there is also a huge disparity in, you know, birthing persons accessing mental health care, getting mental health care. So we have a program kind of dedicated to that as well. It can set folks up with like behavioral or mental health services through the county. One of the things that we offer specifically for that, we like plug in doulas again there. We're like, oh, we should get set up with a
Another way
doula.
that we're kind of funnily, folks come through the Birthwise Wellbeing.
Yeah.
Hey, have you considered a doula? Having extra support can help with your mental health.
Yeah. They can get some like additional care coordination and case management, some additional health education materials. So that's specifically for our perinatal members. And then we have a provider resource guide, which actually goes through like a number of different topics, but it's basically like, as Linda was saying, all the types of community supports that we have available for members. And so what your clients could have access to.
This is a resource, you would be a provider, so that becomes you.
Yeah.
As a provider of healthcare services and services to our members, and so it would be one of the resources you have to be able to say, oh, these are all the things we can refer to here's the phone number.
Yeah.
Here's how the referral can.
We also have a nurse advice line that's 24/7 for folks, so if your client does need anything, if our members do need anything, there's a phone number that they can call. And then we gave a couple examples of 2 flyers. So one is the wellness programs and materials. So this is really focused on all of our like health education offerings. And then our transportation benefit. We do offer transportation for our members. So they can use this flyer, follow the steps to cover either non-medical transportation and non-emergency medical transportation.
You cover non-medical transportation?
We do.
Wow,
That's awesome.
that's impressive. So if mommy just wanted to go to Sprouts to buy groceries, you
No,
go-
well, I think so here's the medical and non-medical. So medical
you.
means a transport that requires an ambulance, an
Ah.
airlift,
Got it.
kind of a higher, and then non-medical transportation would be, you do need a ride, but it
Doctor's
has to be a
appointment.
doctor's appointment. But it would
Got
have
it.
to be something related to your
That's
healthcare services.
still
But it
very
could be
impressive.
anything. It could be a dental appointment, even if that's carved out, that's some other thing, we would pay for it for a behavioral health visit,
Therapy.
even if they need to get to
Therapy.
you for a doula
class.
visit,
It's
like,
still very
they will come
helpful.
into you.
Yeah.
That's still very helpful.
Yeah.
And is that it? Are we all? Done?
I think that's it. I did have I didn't know if y'all, we also have this pregnancy book. So some of these things were just really long. That's why we didn't print out a ton of copies. This is our pregnancy book that we send out to members. I brought a copy of the letter of agreement so you all could just see what that looks like. I have some extra slides here for like Linda and I. This is the contract.
Wow.
So I
See
do
what I mean?
I
have,
read through that yesterday.
I
and
sure-
was
I
like,
did
you
too.
literally could anyway, but there's a bunch of it that's, it's for doctors. I mean, you read
Yeah.
it and it's clear as day. It's like,
Yeah.
that doesn't apply to me, but granted, that's not. Yeah, and I'm sorry, my daughter's having a key issue. I'm having to deal with the key issue.
Aw.
you're
Is the
fine.
contract available online digitally?
They will send it, so it's not publicly online, but they will send it as you request the information. They'll send it by email. They'll have both the whole credentialing packet and the contract.
Yeah, and then this is the credentialing packet, which is also quite hefty. And again, not all of this is applicable to doulas.
So for the contract, does it work if like there's a section in the contract that doesn't apply to doulas? If it's like handwritten, NA doesn't apply, and then signature or initial?
Yeah,
Does that
I would
work?
do that, or just cross it out and
You
signature.
can do that.
void.
That's why we want the contract to be ultimately changed and made simple.
Correct.
Yeah.
Because when there's a whole world of contractual law, and just crossing it out, but you signed it,
Uh-huh.
it's a thing. So for right now, we all know what's going on, but we're pushing for that
So
more
if
precise contract.
If there are things that don't apply to us, we can just cross it out and initial it and.
I would talk to her. I mean, I hate to say I know for sure what that is. I think this would be a really good question for our contracting manager.
Yeah.
To see what's the best way of doing that, because I truly don't know
Yeah.
what would be best, but we can definitely get back.
And as soon as you find out,
Mhm.
let me know.
Yeah.
Yeah.
I'll make sure you all know.
Okay.
So just know that don't take it lightly. It's a big deal. And you want to make sure you're crossing out something that is to your benefit to cross out.
Right.
How do we
There's
know?
a lot of things that you might look at and you're like, is that really related or not? I mean, some is pretty obvious, but some of that I think actually is applicable. Like there's indemnity, there's things about that might in the end protect you as well as
Right,
protect the alliance
Mm-hmm.
for any kind of lawsuits and who's held liable. There are some things that you probably want to have in the contract.
Yeah.
I mean, right now we're doing what we need to do to get things rolling, but it needs to shift. It needs to get better.
Thank you for writing
Good
things
question.
down.
Yeah, and Melissa, actually, our contractor, she really wanted to be here, but today was not a day that she could make it, so she
Yeah.
met with us.
Yeah.
No, we're happy to have the two of you. It's pretty wonderful.
Yeah.
I mean, it's just really
Thank
nice
you
that you.
for having
It's
us.
Saturday. Y'all have things to do. All of y'all have things to do, and so I appreciate all of
Thank you
y'all
all for
being
being
here.
here, yeah.
So, do we get to thank you now?
I just have one question, yeah. For the insurance part, where we need like this $1 million, $3 million insurance, is that like just period as a doula, you need to have insurance, right?
You don't. Doulas don't have to have insurance.
But like with
But if you want to be a
MediCal
MediCal
or
doula, you
with
have
the
to have
Alliance,
insurance.
you have to have insurance.
Yeah.
Okay.
If you want to be a MediCal doula, period, you have to have insurance, which is problematic.
I was just wondering, like, what does that really look like? Like, what does that mean? What is this, a
Somebody wants to
monthly
sue
bill?
you.
Is this a monthly bill then? Is that what an insurance is?
It's a total amount, but it's broken down into monthly payments. You can request, at least the company that I am working with, I don't know if they all do it, but I know that they, with my company, which I'm forgetting, I think it's CM something.
CMF.
Yes.
Mm-hmm.
They have an option where they'll bill you monthly for it.
That was mine. I was just wondering. I haven't gotten to that point yet, obviously.
Yeah, she says we're a small company, but we've been growing like leaps and bounds. So we're like over 500 employees, and we have
It's
Well,
true, I
now
did
that-
say we were small.
400,000,
Yeah.
over
I think I meant
400,000
local
members.
instead of small.
It is local. It's definitely local, but like when I first joined 12 years ago, we had 120,000 members and under 100 employees. We have
Yeah.
grown almost fivefold in the last
Yeah,
10
because
years.
of the people who have
And
to
it's
have insurance.
exceptional, like
Yeah.
all these, I mean, there's a positive and negative, right? A negative in feeling like, oh, more people have to have insurance, but the reality is the eligibility has gone up. So, we just, at the beginning of the year, brought on 30,000 new members who were not previously eligible.
Yeah,
So
they're not
they were getting health pack, they were having some modified kind of insurance, but not medical benefits.
Yeah.
And so it's pretty exciting that it's expanding the folks
Yeah.
who have full-fledged insurance.
Yeah.
And at the same time, during the pandemic, it was, folks were coming on in droves.
Oh my
It's a
gosh.
need.
Yeah.
Yeah, for sure.
Good thing.
Yeah.
So you guys are just in Alameda County. Who's in Contra Costa County?
This Contra Costa health plan,
Oh,
yeah,
right.
they have a similar health plan. Also, one plan county in San Francisco health plan.
San Francisco has its own. San Francisco County. San Francisco is a city and county. So, I'm on the phone. I'm going to try to be getting all of the folks to come in. But these lovely folks were the first ones to just speak. Yeah, we'll be there. So that was really nice. Any more that you have to share with us?
I don't think so. I do have some additional, emails and phone numbers. Melissa, who was not able to be here with us today, works in our contracting department.
I would love
She
that.
wanted to share her contact information with you all.
Great.
And then I also have an email for our contracting department and our credentialing department as well. So if you do have any contract or credentialing related questions, you can send, these departments have big group emails, so many people have access to them. It's not just emailing one specific person in case they're out or what have you.
Do you have any contact with billing people? Because that's the.
Not
that's-
with
So
me, but
usually
yeah.
billing questions go through provider services. So
Okay.
you would call provider services and then get you connected with whoever.
For me as a doula, having a billing concern, I would
Mhm.
speak to. Okay.
Yeah.
I would go to the provider services department and then they'll fund it to, try to help you resolve the issue or find the person you need to talk to.
Yeah, because that's a big issue.
So there's three,
Yeah.
so there's contracting for contracting questions, credentialing for credentialing questions, provider services for provider,
service,
customer
yeah.
service for all of our providers, and again, doulas are providers. And then there's also a doula email that we established, because we're health ed, we're pop health, we're program people, right? We're the
Right.
ones who are working with new organizations, getting out, thinking about how do we share the good news, how do we get providers and members on board. And so we also have an email, so in all those other things are going wrong, email us at doula@alamedalands.org and we'll see what we can do to reach those.
That sounds good.
Yeah, we can help.
So thank you very much.
Thank you all.
I have walked by this, I